Well, joining us on the situation in the U.S. is Dr. Mercy Dionwe. She's an internal medicine hospitalist doctor there. Thank you for joining us on the program.
Thank you for having me.
All right. I mean, 1,000 deaths per day. Are you worried by the statistics coming from the U.S. and what would you say is fueling it?
Yes, we're very much worried. Just like the previous video had said, there has been a great increase of rates here in the U.S., particularly in the South. I am a hospitalist, so I deal with patients in the hospital, and we too have had to hold people in our ER rooms as the rooms upstairs in our hospital are completely full. What I think is probably fueling it is two things. There is still that high rate of people who are hesitant to get the vaccine. And the second thing is this Delta variant is very contagious and so has spread like a wildfire in the States.
But there are those we hear are getting, who have gotten vaccinated, but are also getting COVID. So there's also the mask mandate. But how many people are adhering to that?
So here in Texas, where I do reside, because of our politics, our governor has said that, there is no such thing as mask mandate and he does not want to do it. So we are seeing people not as, I want to say, they're not as strongly adhering to wearing masks, but some are. And so I would say there's still a great percentage of people who are still not wearing masks, and that is contributing to our rates. Yeah.
But as a public health professional, what would you advise?
So what I would advise is two things. It's proven that the vaccines help to reduce your chance of getting COVID-19. For example, for me in the hospital, majority of the patients, if not actually all the patients I've admitted that have COVID, are those that are not vaccinated. Yes, as you had alluded to, there is some breakthrough cases, meaning there are some people who are getting the infection despite being fully vaccinated, but there are, I would say, less than 5% compared to 90+% of those who are not vaccinated that are getting the COVID case. So I would say two things. Mask does help prevent you from getting the disease. So regardless of if you're vaccinated or not, please wear your mask. And then the second thing, consider getting the vaccination. I have been I've been working in the hospital since COVID started. I am not seeing any cases of people coming in as a result of a very bad case of a reaction from the vaccine. Yes, you may have some, symptoms that last 24 to 48 hours, very mild. But for the most part, what you're looking for is that immunity against the virus. And that's what's going to kill you, the virus.
And that's why vaccines are important. Thank you so much, Dr. Mercy Dionwe, internal medicine hospitalist, Texas, US. Thanks again.
Thank you.